On April 16th, 2008, a gentleman running for President of the United States, I won't give you his name, he said, and I quote, "What I have proposed is that we raise the cap on the payroll tax because right now millionaires and billionaires don't have to pay beyond what was then $97,000 a year. Today it's $106,000 a year." That same gentleman, whose name will not be mentioned but who did win the election, in 2008 continued, quote, "Now most firefighters and teachers, they're not making over $100,000 a year. In fact, only 6% of the population does. And I've also said that I'd be willing to look at exempting people who are making slightly above that. The alternatives like raising the retirement age or cutting benefits or raising the payroll tax on everybody, including people making less than $97,000 a year, those are not good policy options." And it really was Barack Obama who said that, in case you didn't know that. What do you think?
This is a hard question.
I know.
And
in other words, what the president said to me when he was campaigning makes eminent sense. Is, in fact, while Social Security is not in crisis right now and can pay out every nickel owed for the next 29 years, we want to make it stronger, even in years beyond that. What the president proposed during his campaign is to get rid of the cap, maybe start higher than 106,000. I think that makes sense. Do you want to comment on that? Or?
well, the only thing I can say is that if I were to comment, it would be well beyond my area of expertise. But I do think that over the years, as a citizen taxpayer myself, I know over the years a lot of ideas have been floated, and it seems to me that we ought to examine that one very carefully.
Good. Thank you very much. Thank you, Mr. Chairman.
Well, I can't help but remark on that. We often talk about the middle class in America, and I think we've gotten a little confused as to who is the middle class in America. At $250,000 a year income, that's the top 2% income earners in America. 98% of the American people make less than $250,000 a year. At $150,000, that's 5%. In other words, 95% of the American people who are out there working make less than $150,000 a year. I think we've forgotten the people in the middle class are those that are making 35, 40, 45, 50, 60,000, 65,000. That's the bulk of where Americans are today. And we forget about that. And they are rightfully concerned about a lot of things, but I think the fairness, about what Senator Sanders just said, the fairness of this. If you're an American making $40,000 a year, you pay on Social Security, on your payroll tax, on every dollar you make. If you are a person making $400,000 a year, you only pay on Social Security on 25% of what you make.
Right.
1/4. Where's the fairness in that? So I can understand that the middle class in America is upset. I don't mean the people making $150,000 a year. I mean the people making $40,000, $50,000, $60,000, $35,000 a year. I can see why they're upset. So that's just, I didn't mean to get into that, but you brought it up, so there you go. It's just grossly unfair. But I have one other issue I just want to cover very briefly. As you know, the amount of money in IRAs dwarfs the amount of money in the 401k account.
Absolutely.
Because people frequently roll over their 401ks into an IRA when they leave a job or transfer. But we know that's not always the best decision. And I'm concerned that some employers may be trying to cut costs by forcing people to do a rollover. Or in some cases, services providers may be trying to earn a higher fee by encouraging rollovers. Is the department looking at rollovers, and in particular the communications to workers from employers and service providers regarding rollovers?
Mr. Chairman, we are looking at it. We have a legal problem, though, in that once the money is rolled out of the ERISA-covered plan, it's not quite clear to me how we can reach the money in the IRAs. But we certainly can look at all the behavior around the rollover decision, the information people are given, making sure that it's accurate, making sure that there aren't conflicts of interest associated with it. And so we are looking into this, yes.
Do you plan to take steps to implement the IG's recommendations, Inspector General's recommendations?
I'm sure we will be doing whatever we can to meet what the IG has suggested.
Well, again, again, disclosing any possible
Exactly.
conflicts. And that
Exactly.
kind of thing.
This question of disclosure is really important.
Well, I really want to work with you in the department on this whole issue of the rollovers into IRAs and how they're being promoted, and the fees that are being taken, and how people are being enticed to do that. That's one area. The other area is the whole area of borrowing. It seems to be growing, maybe even exponentially on this, I don't know. But we need some good data on that and how many people are defaulting on these loans, unable to pay them back.
Well, we will get you whatever data we have, Mr.
I
Chairman.
appreciate that very much. Did you have any follow-up questions at all?
Just very briefly, so you said something that I have to comment on. We can go on all day here, but just very briefly. As you know, Ms. Borski, Social Security not only covers the elderly, but it also is a very important part of the lives of people in our country with disabilities.
Absolutely.
What happens to the 8 million people currently receiving Social Security who have disabilities, and the 4.5 million widows and widowers, and $4.3 million children, 4.3 million kids who are receiving Social Security if we make cuts in Social Security? In other words, my point is there are a lot of, as Senator Harkin has said so aptly, people are hurting all over this country. And it is so easy for people up here, you know, who have a whole lot of money or take campaign contributions from millionaires and billionaires. Oh, we got to cut these programs. What happens if you're a widow trying to raise 2 kids and your sole income is Social Security? What happens to you when you cut that?
We need to protect those people.
We sure do. Thank you very much, Ms. Borsi.
Thank you.
Thank you, Ms. Borsi. We look forward to the information that I've requested. Thank you.
Yeah.
We'll now move to Panel 2. Panel 2, we have 3 witnesses. The first will be Mr. Jack Vander. He is the Research Director at the Employee Benefit Research Institute. Dr. Vander has more than 100 publications devoted to employee benefits and insurance. His major areas of research focus on the financial aspects of private defined benefit and defined contribution retirement plans. Dr. Vander will give us some statistics regarding participation and savings. And then we have Mr. Ross Eisenbray, Vice President of the Economic Policy Institute. Prior to joining the Economic Policy Institute, Mr. Eisenbray worked as a staff attorney and legislative director in the U.S. House of Representatives, a committee counsel in the U.S. Senate, and as policy director of the Occupational Safety and Health Administration. Mr. Eisenbray will talk about how the system is failing many workers and the importance, again, of Social Security. And finally, we will hear from Shireen Miller, a home care worker from Falls Church, Virginia, who will give us a firsthand account of the challenges workers face in trying to prepare for retirement. And for all of you, your statements, your written statements will be made a part of the record in their entirety. And I'd ask if you could just sum it up. And the clock says 5 minutes, but 5, 6, 7 minutes. I won't get too excited, but once it starts going over 7, I'll start getting a little nervous, okay? But somewhere in that range, if you could sum it up so we could get into a nice exchange here, I'd appreciate it. Mr. Vander, I've read your testimony, extremely interesting and insightful, but please proceed.
Thank you. Good morning, Chairman Harkin and Senator Sanders. I am Jack Vander, Research Director of the Employee Benefit Research Institute. EBRI is a nonpartisan institute that has been conducting original research on retirement and health benefits for the past 32 years. EBRI does not take policy positions and does not lobby. Today's testimony will deal with the following 4 topics. First, sponsorship and participation in employment-based retirement plans. Secondly, the national and individual retirement adequacy deficits. Third, the importance of Social Security. And fourth, Americans' retirement confidence. First, a quick look at the numbers will tell you where the nation is today when it comes to Americans' participation in retirement plan. Among all of the 154 million Americans who worked in 2009, almost half, just over 49%, worked for an employer or a union that sponsored a pension or retirement plan, and almost 40% participated in a plan. For full-time, full-year wage and salary workers between 21 and 64, 54% of these workers participated in a retirement plan. Obviously, the likelihood of a worker participating in an employment-based retirement plan goes up sharply with employer size. For workers at employers with fewer than 10 employees, less than 14% participated in a plan, compared with 53% of those working for an employer with 1,000 or more employees. Now, looking at the more than 78 million workers who did not work for an employer sponsoring a plan in 2009, about 12% were self-employed. Of the remaining 69 million workers who were not offered retirement benefits, almost 10% were under the age of 21, and about 5% were age 65 or older. Almost half, 48%, were not full-time, full-year workers. 27% had annual earnings of less than $10,000, and more than half, 57%, worked for employers with less than 100 employees. What these numbers show is the structural reasons why many Americans do not have employment-based retirement benefits. They don't work full-time, they work at small firms, or they are very low income. Measuring retirement income adequacy is an extremely important complex topic, and EBRI started to provide this type of measurement in the late 1990s. When we modeled the baby boomers and Gen Xers in 2010, as you mentioned earlier, between 44 and 47% of the households were projected to be at risk of not having adequate retirement income for basic retirement expenses plus uninsured health care costs. Even though this number is quite large, the good news is that that is 11 to 12 percentage points lower than what we found in 2003. Who's most at risk? Figure 1 of my oral testimony shows, not surprisingly, lower income households are much more likely to be at risk for insufficient retirement income. The 2010 baseline at-risk ratings range from 76% for the lowest income households to only 20% of the highest income households. Figure 2 in my oral testimony shows the average retirement income deficits by age, family status, and gender for baby boomers and Gen Xers. The average individual deficit with current Social Security retirement benefits is estimated to be approximately $48,000 per individual. If you were to eliminate Social Security benefits, that would increase to approximately $89,000. In aggregate terms, that would be an increase from $4.6 to $8.5 trillion. The importance of Social Security retirement benefits for low-income workers is shown in Figure 1 of my testimony. 91% of the lowest income households would be at risk of inadequate retirement income if they had no Social Security retirement benefits, and that's compared to 76% with the current Social Security benefits. Perhaps surprisingly, the other 3 higher income quartiles also benefit from Social Security to the extent that 24 to 26% of households in those groups are saved from at-risk status because of Social Security retirement benefits. Not surprisingly, these trends have been clearly reflected in our annual retirement confidence survey for the last 20 years. Only 16% of workers in the 2010 RCS say they are very confident they will have enough money to live comfortably through their retirement years. Moreover, those who say they are saving has not grown. The percentage of workers who reported they and/or their spouse had saved for retirement now stands at 69%. In addition to the lack of improvement in percentage savings, the percentage of workers who have virtually no money in savings and investments has increased over the past year. As you've already mentioned, among RCS workers providing this type of information, 54% report that the total value of their household savings and investments, excluding the value of their primary home and any defined benefit plans, is less than $25,000. The propensity to guess or to do their own calculation may help to explain why the amounts that workers say they need to accumulate for a comfortable retirement appears to be rather low. 29% of workers say they need to save less than $250,000 for a comfortable retirement. Another 17 mention a goal of between $250,000 and $500,000. Thank you for the opportunity to testify today, and I welcome the opportunity to work with the committee in the future.
Thank you very much, Mr. Vanderhei. And now we turn to Ross Eisenberg. Ross, again, your statement will be made part of the record. Please proceed.
Thank you for inviting me.